Good evening, everyone. Thank you for joining us for our COVID-19 update and our virtual town hall meeting. Normally, over the last 17 months, we've had weekly press conferences. Actually, a year or so ago, we had a couple press conferences a week, and we started to then have one press conference a week, and we've decided now to suspend the weekly press conferences, and so we did not have one last week as we celebrated the 4th of July, and it was great to have a week off, mostly because things had gotten much better in our state with respect to COVID-19. We did commit to periodically to do press briefings on the status of our COVID-19 efforts, but also to do town hall meetings like we're doing tonight, where we'll have a brief presentation and then we'll entertain questions that are texted into the website. We're joined again by Dr. Carol Rattay, the Director of the Division of Public Health. We thank her for coming in and all the great work of her team over the last 17 months, and AJ Shaw, heading up our Delaware Emergency Management Agency and point person on testing and vaccinations over the last year and a half as well. And he and his team and Dr. Rattay and their team's just doing an outstanding job. And of course, Pam, who's our sign language expert for the deaf and hard of hearing, we appreciate her joining us as well. We'll have our normal presentation. I'll go through some of the data as we would normally do in a press conference, and then we'll go to spend most of our time on questions. We did, thankfully, thanks to all of you, reach our goal, President Biden's goal of having at least 70% of adult Delawareans, 70% of Americans with at least one dose of the COVID-19 vaccine by July 4th. We met that goal a few days early, and we're up to 71% of adult Delawareans. We still do have, particularly younger adults, less than 50% of our 18 to 35-year-olds have received one dose of the vaccine. So more than 50% are not vaccinated, and that is an area of concern. We'll talk a little bit about that. But it was a great celebration on the 4th of July to have met that goal of 70%. We know we're a better and safer place from COVID-19 as a result of that. We did have parades. We had a great parade in Smyrna in the morning on Saturday, and a parade Sunday afternoon in Dover, and fireworks across our state. It was great to see so many people out to celebrate independence in a way that we haven't for some time. Let's go to the data update. We hit a low about 2 or 3 weeks ago on all of these measures. New cases on a 7-day moving average. Now we're just at 29. We had reached below 20 at 19 for a couple days 2 or 3 weeks ago, and percent positives now. So the number of tests that we're doing is there are fewer tests, and so the denominator is smaller here, but again, the numerator is still a little bit higher, 1.8%. We were under 1%, about 0.8% 2 or 3 weeks ago, and so these numbers have ticked up a little bit. We hit a low of hospitalizations of 14 on a daily basis, went up a little bit over 30 there, and then have leveled off now at 27. Sadly, again, almost 1,700 lives have been lost with COVID, 1,695, although we are seeing very few people who are passing away from COVID, mostly because we have such a significant portion of our senior population. We'll see that on the next slide with the vaccine update. Total vaccines administered, we've gone over the million vaccine mark at 1,060,601. And I want to thank all of our partners who've helped us there. The county paramedics, Dover Downs with the clinics we had there for several weekends, doing 10, 15,000 over a weekend. The DMVs, Delaware Motor Vehicle, came up big. Our partners at DelDOT were excellent there. Chase Center, we had some very strong vaccine events at the Chase Center with help from Walmart. And our pharmacies really, and then the last month or two, our pharmacies were doing overwhelmingly most of the vaccinations, and we appreciate those, Walgreens, you name it, across the board. They were just doing a great job. So we did reach our goal. We're up to 71% of adult Delawareans 18 and over with at least one dose of the vaccine. And again, one of the reasons we're seeing so few of our seniors pass away from COVID, which are the most vulnerable population, almost 94% of Delawareans 65 and older with at least one dose. So that's over 90 or almost 94%. And again, at the same time, though, we have young adults who feel less vulnerable for sure. And the data supports that. But we need them to get vaccinated because we could have an outbreak. And many of the cases that we're seeing now are in that unvaccinated group, 18 to 35-year-olds, young adults. So if you're in a bar and a restaurant where they're mostly young adults and nobody's wearing masks, a lot of those people are maskless, unvaccinated folks. So if you're unvaccinated, you should be wearing a mask in those kinds of environments. So we did lift the state of emergency as of today, July the 13th. We do have some minimal public health emergency orders in effect, mostly to enable us to deliver vaccinations and vaccination administration and testing programs, allowing people who have certain certificates out of state licensing to do work in our testing sites, in our vaccination sites, in nursing homes, some of the orders that affect those. But we do not have the broad state of emergency in effect as of today. So one of the questions we're hearing from most people is, are we be wearing masks? If you're not vaccinated, wear a mask. When you're in public, in an indoor space with other folks, people who are vaccinated, fully vaccinated, the CDC's recommendation, you're good to go without a mask. The risk is very low, but if you are not vaccinated, you are at risk when you're in those indoor spaces, particularly with cohorts of individuals that might be in your demographic. We do lastly want to get the information out about renters assistance, our emergency assistance for renters through the DHAP program for eligible renters experiencing a financial hardship as a result of COVID-19. Payments are made through this fund directly to the property owner. So not to you to pay your rent, but to the property owner. So make sure if you're having trouble paying your rent, go to DE COVID Housing Help, decovidhousinghelp.com, and you may be eligible for assistance, for rental assistance. Again, thank you all for joining us. Next up is Dr. Carol Rattay.
Great, thanks so much, Governor. And like often on our weekly updates, I start with a little bit of an update on our cases. Our case rate, as you mentioned, has decreased slightly by actually about 7% in the last week. It is, however, a little concerning that our 7-day average for % of total tests that were positive is increasing. It went from 1.2% the week before to 1.8% as of Sunday, as you mentioned, Governor. And while we haven't seen any new COVID-related deaths in at least a week, which is great, our hospitalization numbers have increased slightly and are bouncing around the 20s and 30s right now. I often talk about, are there geographic areas or zip codes of concern? And again, we have no identified zip codes or areas of concern in the past week, which is good. But now that the state of emergency has lifted and masks and social distancing are not required, we really, really want to honestly beg everyone not to get lulled into believing that COVID is gone. We are still seeing cases in Delaware, and cases are increasing across the country. We continue to see them largely in persons who are either not vaccinated by choice or because they are not eligible. We are also seeing increasing cases of the Delta variant, and we want to remind folks that this is this variant is more easily transmissible. The vaccines are highly effective against this and the other variants we're seeing, but if you're not vaccinated yet and are eligible, we really encourage you to get vaccinated now. So for our update this week on the variants, we are seeing a little bit of a change. Previously, that UK variant or the Alpha variant, we were seeing pretty significant increases every week. That was clearly our most predominant strain for the past few months. This past week, we only saw 9 of the Alpha variant. We saw 3 of the Gamma variant, but the Delta variant, we saw 8 this past week, which may not seem that much, but for previous weeks, we were seeing pretty much 2 every week. So this is a jump in the number of Delta variant cases that our surveillance system is finding for us. And the CDC recently shared a study that just shows an example of how easily transmissible this Delta variant is. There was a gymnastics meet in Oklahoma, and 47 of the individuals at that meet, the gymnasts and staff in the facility, became positive for COVID-19. So approximately 20% of the people in the facility became positive, and about 53% of their household contacts became infected. And this is a much higher attack rate, we call it, than what we have been seeing among the original virus and the other variants. Now, I will add, in that gymnastics meet, there were several risk factors identified. People were close to one another. They were not wearing masks. About 85% of individuals in that that became positive were not vaccinated at all, and only 6% were partially vaccinated. But it really shows you that this variant can spread very quickly. Let me shift now topics to schools. So this past Friday, the CDC updated guidance for K through 12 schools and separately for childcare. And if you've been watching our weekly press briefings, we've been eagerly awaiting the new CDC guidance. And quite frankly, we're not really seeing anything super surprising in this guidance. We think that it provides flexible, science-based approach to support in-person instruction. I think key to all of this is we all want all kids back in school. And so the goal is, how do we do that as safely as possible? So the key takeaways are vaccination of eligible individuals is what is really so important to helping individuals safely return for in-person learning, extracurricular activities, including sports. So vaccination, we're going to continue to emphasize and work on that. Mask wearing for those who are not fully vaccinated is going to continue to be very important. So for those who are age 2 and older who are not vaccinated in the school setting, we very strongly recommend, as does CDC, of course, that individuals are wearing masks in a school setting. Social distancing, you've heard us talk about making sure that kids are 3 feet apart in the school setting, and that includes wearing a mask at the same time. But CDC emphasized, and we agree, that what's most important is that we get kids back to school. So if that 3 feet distance is a barrier, we want schools to be able to do what they need to get the kids back in school. You can go a little closer than 3 feet as long as those unvaccinated individuals are wearing masks. And so, CDC guidance was really consistent with what I think we all expected and hoped to see. And what they really highlight is the importance of layering these prevention strategies, because no one strategy is going to work. And the reality is there's a lot of unvaccinated individuals in the school setting, or there will be in the fall still. So this physical distancing, mask use, routine testing of unvaccinated individuals, hand hygiene and cleaning. This is all very important, and especially for protecting those who are unvaccinated. They also are recommending that the localities, the districts, the schools monitor the levels of community transmission, as well as vaccination coverage in their settings, as well as promoting screening testing and also monitoring their results, as well as monitoring outbreaks to make their decisions. And really, because of the importance of vaccination for safe return to school, Department of Education is working with us on a communication to school administrators to really encourage vaccination events, to hold their own vaccination events, as well as to promote community vaccinations. And additionally, as we saw last year, that there were a number of cases among athletic teams. We're also working with DOE to outreach to athletic directors and coaches to encourage them to protect their athletes and families through vaccination. So I just want to finish with just touching on the safety and science surrounding the vaccines. We know that this is of a concern of parents and families and those who may not yet have chosen to get vaccinated. We just launched an About the Science page on our website, de.gov/vaccine science, that provides answers to frequently asked questions about the safety and the science behind the vaccine, including from experts, Delaware physicians like Dr. Joan Coker, seen here. We will continue to share information on the safety of the vaccines as it becomes available. As a reminder, you can also find information about the vaccine for 12 to 15-year-olds on our website. And since parents indicated they feel most comfortable getting kids vaccinated by their pediatricians, we're also going to continue to encourage parents to work with their pediatricians to ask questions and to get their kids vaccinated before they return to school in the fall. And with that, I will turn it back to you, Governor.
Thank you very much, Dr. Rattay. And of course, the primary objective, get children back in school for in-person instruction. And that's going to be our major focus from now until the day that school opens in the fall in September. I know we're also focusing on the districts and their efforts over the summer to accelerate learning and get children caught up to lost learning with the more remote circumstances of the last year and a half. So that's the primary objective there. And the best way to achieve that is through vaccination and those mitigation efforts that you've talked about. CDC also talks, as you mentioned, about a lot of flexibility for states based on the percentage of their populations that are vaccinated, based on the situation on the ground in terms of the presence of the virus and the spread of the virus. So keeping our numbers down is going to be critically important. Getting our numbers up with respect to vaccinations is going to be critical as we get our children back in schools. AJ?
Good evening, sir, and good evening, everybody. A few updates here. We'll talk about vaccination in the community. And I think we reported 2 weeks ago or 3 weeks ago now about, as we've seen, there's been a huge shift in where people are getting vaccinated. Earlier in late winter, early spring, it was a lot of the drive-through events that public health or other partners would facilitate and get people through the high volume quickly. And as the season went on and we got more vaccine, the pendulum swung the other way. And now we're seeing, about 70% or so, a little bit more some weeks of people getting vaccinated either from their primary care physician or their pharmacies. But we still have teams that are out there in the community. Curative works with us again. They'll be at the Newark Main Street event tomorrow night, Rehoboth Beach City Hall, Delaware State University, and then the Farmers Market in Milford. But if you go to the website, d.gov/find my vaccine, we also have all the other community events. There's church events that pop up on the weekend. There's events that Lisa Henry's team over at Community Health and the National Guard are doing. So, they're the smaller events. We talked about it, anywhere from 10 to 15 people, but we continue to do those and balance it. So there's ample opportunities out there for both vaccination as well as testing. You go to the coronavirus website for both of those. Then when, it's been a great Fourth. I think the governor opened up with that. A lot different than last year. Last year was a 4th of July that a lot of us, never experienced before. Lack of events, lack of fireworks, etc. And we look at how do we get here? And we got here because of people being flexible, the community really coming around us and helping us. And that's what's been important the last year. So this is from our partners like the Delaware Food Bank, the United Way, where it runs a 2-on-1 for the state, to all the church groups that have hosted either vaccination or testing clinics or reached out to public health to provide verified feedback. The voluntary groups active in disasters or VOADs that have worked on stuff. The fire service that has, whether it's been hosting a vaccination site at their departments or when we needed additional EMTs to be trained to help vaccinate, really the community is what helped us get through last year. And so if you go to de.gov/COVID vaccine, there's a Delaware Strong storyboard that we're looking for people to really, provide feedback and input of, what happened to you in your community over the last year. And it's a great way to recap what happened. We got to think, the governor said 17 months ago we started this journey, and it feels like it's been about 17 days, but definitely a long 17 days. And then finally, can't talk a week after a tropical storm without talking about a little bit about hurricane season. Starts in June, goes through the end of November. Usually the Atlantic is or where we are in the mid-Atlantic is active during the late summer, which I'll say, mid-August on, where we'll see some systems approach us and maybe impact us to some extent. Last week, we had a tropical storm come right up the coast and provide us a little bit of excitement on Thursday night, Friday morning. And really, we've talked about this before. We want people to have a kit. We want them to have a plan of what they're going to do. But you have to stay informed because we got a lot of feedback. We had a lot of questions about this tropical system that was coming up the coast last week because what they remembered was Isaias from a year ago, which had multiple tornadoes. A tornado that went over 30 miles from Dover up through Middletown. But you have to kind of pay attention, whether it's to Facebook, to the weather service, to others, to see what the impacts are, because not every tropical storm is the same. Not every hurricane is the same. It's not going to impact us all the same. So we want to make sure people stay informed. They know when they need to take action. And I think it's fair to say that the tropical storm system that came in last week was no more, newsworthy than some of the thunderstorms we've had, or severe thunderstorms we've had in the last few evenings across the state. So, stay informed. And then the other thing that we really want to, hit home on this year is do an insurance checkup. Make sure you check your insurance policy. Make sure you understand what it covers, what it doesn't cover. Because last year, that was a lot of what we saw in some of the Bear, Middletown, and, Smyrna, Clayton area, the people that had these maybe damage to their property, but not to their house. And it wasn't covered by insurance, and kind of what were their options that they had at that time to really start the recovery. It's an impact for everybody, no matter how big or how small, whether it's 5 people or 100, we know it hurts some people, but what we could do today is prepare ourselves just a little bit more by taking those simple steps. So with that, Governor, I'll turn it back over to you.
Thank you, AJ. And there are people being vaccinated every day, still, over between 500 and 1,000. So we're knocking them off kind of a day at a time. We need to do that. We've delivered over 1 million vaccines and over 2 million people, 2 million tests, 743,000 people tested. So incredible work by your teams, AJ, there, Public Health and Delaware Emergency Management Agency, with 2 million tests and over 1 million vaccines. So that's it in terms of the presentation. I know this is a town hall meeting. We've got lots of questions from people who've joined us tonight.
Thank you, Governor. We'll go to the first question. We had several questions about the Delta variant, Dr. Rattay, and this one's specifically for you. Barry asks, is the Delaware Division of Public Health concerned about the Delta variant spreading in Delaware the way it's spreading in some other areas of the country?
Yeah, so it is a great question, and we are concerned about the Delta variant. We are concerned that it is much more easily transmitted, even than the UK variant, and so it's easily spread from person to person, especially among unvaccinated individuals. And as we're seeing across the country right now, in those pockets or those areas where there are lower vaccination rates, we're seeing lots of outbreaks of the Delta variant. And so we are concerned, as the governor was saying, we still have an awful lot of Delawareans who are not vaccinated, and that's especially among our young adult population and our children as well. And so we are very concerned that we're going to see some outbreaks, perhaps soon or maybe in the fall, from the Delta variant. And so I think the most important thing I can end this answer with is vaccination. These vaccines work against the Delta variant. And so, I think it is such an important reason why we all should feel urgency to get vaccinated if we haven't already, so that we in Delaware don't have to have another surge from this Delta variant.
So the answer to a lot of these questions is going to be get vaccinated. The more people we have vaccinated, the better off we're going to be getting children back in school and addressing some of the variants and some of the other challenges that we have.
Thank you, Governor. Dr. Rattay. Katie West in the pre-submitted questions has a follow-up for that. She says case numbers are low in Delaware, but they're rising slightly here and across the country, mostly due to the Delta variant. If the upward trend continues, would you consider reinstating some restrictions, such as a mask mandate or any other capacity restrictions, Governor?
Yeah, I don't think we're going to be talking about it or looking at it from the perspective of a state of emergency requirement to do this. I mean, we can't afford to go backwards in that respect. That doesn't mean you can't wear a mask. I keep my mask with me all the time to be respectful. If I go into my favorite Wawa, the employees there, many of them wear masks. They're not required to do so, but they do. Out of respect for them, I'm fully vaccinated, so I don't have to wear a mask. But people should be thinking about their own safety. I know when you go into a place and it's mostly young adults and nobody's got masks on, some of those folks are not vaccinated and they should be wearing a mask to protect themselves. So it's more of a recommendation, personal recommendation to take the responsibility there. I think we're not going to be able to go back unless it gets really bad, and we'll keep our eyes on the conditions on the ground in terms of the number of positive cases, the percent positive, but our numbers now are quite low. If you look back over the history, the 17 months of this pandemic. Dr. Rattay, any thoughts there?
No, I mean, I completely agree with you, Governor. And I thought, again, getting vaccinated is really the key. None of us have any desire to go backwards, and getting vaccinated is just key to preventing that. But if for whatever reason you're not vaccinated, you're not eligible, or you've chosen not to be, then we know what works, right? Wearing a mask and social distancing, it works.
Thank you, Dr. Rattay. We also got a lot of questions, as you might expect, on schools and vaccination for 12 to 17-year-olds, especially. We had a pre-submitted question here that says, what is the evidence that children who typically have only mild illness or no symptoms benefit from having this vaccine that is approved under the emergency use authorization by the FDA? Dr. Rattay, can you address that, the benefits of the vaccine for the 12 to 17-year-old age?
Yeah, absolutely. And so, I think we've all seen that adolescents have milder illness, or tend to have milder illness compared to, for example, our senior citizens. We certainly see, we can see some more serious consequences. For example, among children who have underlying health conditions. We do see kids who are hospitalized. We do see kids with this MIS-C syndrome. And we're also, learning more about long COVID among kids. So just because kids are more likely to have mild or asymptomatic cases of it doesn't mean that they may not have more serious or long-term effects. When you look at our infection rates now, you see that that we're seeing really more rapid increases among our kids compared to other age groups. So certainly it's, if not the age group where we're seeing the highest rates of infection right now, certainly we are seeing infection among this age group. And this age group then, certainly that's disruptive to school. It's disruptive to, kids just living their life, being in sports, being in activities, but it also is important in protecting their loved ones, their grandparents, their parents. And so there really are many reasons for kids to get vaccinated. And these vaccines have been shown to be extremely effective among this 12 to 17-year-old age group. And so, we just, can't emphasize enough how important it is. And again, one last point, the safety of this vaccine among this age group, adverse events are just extremely rare.
It's also important to point out, John and Dr. Rattay, that we're doing pretty good vaccinating that group. Almost 40% of 12 to 17-year-olds are vaccinated. You compare that to the 18 to 34-year-olds, which is where the problem is, and they're just 3% better. And the 12 to 17s have not been eligible for as long. So we're making progress. We're going to continue to make progress as we move towards the school year. Those vaccines are safe and they're efficacious for those children.
Thank you, Governor. So we also have a lot of questions about masks and not surprisingly, some disagreement there. So just a couple from both sides. Dee Dee Bush thinks face masks are harmful for children. She's asking if they'll be required next year. Jen Staley says, what's going on with school? Will masks be required? She hopes they will be, especially for those under the age of 12 who are not yet eligible for the vaccine. So could we just go through again the CDC recommendations for schools? I think we have the slide on that. But Dr. Rattay, what would you say about masks in schools?
Yeah, I think in CDC, along with their new guidance, produced a science brief, which they do a really great job of summarizing the science for kids as it relates to school. And there's a really good section there on mask wearing. There's abundant evidence to show that masks are very effective and helpful in decreasing the spread of infection. We know that there's multiple strategies and approaches to preventing spread, but masks undoubtedly are extremely important. And so CDC, again, has very strongly come out with the recommendation that unvaccinated individuals should be wearing masks, especially in the indoor setting. And so we certainly agree with their read of the science. I will say, I do know that there was a very small study that was released this last week that suggests there may be harm, but I think there's a lot more that needs to be looked into on that very small study.
Thank you, Dr. Rattay. And I sorry to keep coming back to you, but I think this is for you as well. Patrick Brady, who's watching on YouTube, asks, why take the shot if you've already had the virus? Is there guidance from CDC or DPH on if you've already been infected with COVID, whether you should have the vaccine or not?
Yeah, it really is a great question. CDC, again, is strongly recommending that individuals who have had COVID-19 do get vaccinated. We don't yet have a great understanding of how long your natural immunity from COVID-19 is. There are some studies that really show that the vaccine can really pretty rapidly increase your immunity if you've had COVID-19 before. So it's including the history with getting a vaccine, you should be pretty well protected. But again, we do agree with CDC's guidance that individuals who have had COVID-19 do get vaccinated for their own protection.
Thank you, Dr. Rattay. We had a couple questions about COVID-19 testing. Really simple one here from Rosa Romney in the pre-submitted questions. I think for AJ, does Delaware have any free COVID-19 testing sites remaining? And I think we do. Is there anything we can tell Rosa?
No, so I think, we will continue to have some free testing sites available. I think, I know we still are using Curative. They have 4 sites a day, usually about 5 days a week. Sometimes we'll do Monday through Friday. Sometimes we'll do Tuesday through Saturday to get some weekend access hours there. We also have our some of our Walgreens sites that are still doing testing. And then there are some state service centers and clinics that are also doing testing. So you could go to de.gov/get-tested to find out what is near you, what the process is, whether you need an appointment or you don't, but it is still free and it is still readily available throughout the state. We did see another about 15% decline last week in testing. So, I think that's a little bit reason why we might see the uptick in the percent positive. We did, I want to say 10,400 the week before. We were at, down in the 9,500 range last week. So the testing access has not been, scaled back. There have been a few, I think there's been a few sites that were in the single digits a week that we we've shut off in the past, but still plenty of options out there. So go to de.gov/get-tested to look at all the options.
So Dr. Rattay, if you're symptomatic, you really should get tested, right?
Yeah, absolutely. There are individuals who should still get tested if you're unvaccinated and you're in settings, certainly, for example, working in long-term care, healthcare, school, or any congregate setting, you still should be getting regularly tested. Even if you've been vaccinated, though, if you have any symptoms of COVID, you should get tested as soon as possible.
Yeah, and so we know it's out there. Any Phillies fans that have joined us today, if you noticed this week, we had the problem up in Boston where one of our guys, our third baseman, was tested positive. The other guys who were subject to quarantine because of contact tracing were subject to quarantine because they had not been vaccinated. And so we lost a start by our ace, Nola. Turns out we won the game anyway, but that virus is out there, particularly among that demographic, young adult demographic. And so we need folks, as Dr. Rattay says, if you're working in those environments and you're not vaccinated, you need to get tested.
Thank you, Governor. I'm going to ask a follow-up to that from Dawn Pickett. And I think you may have answered this, Dr. Rattay, but she said she's fully vaccinated against COVID-19. Does she need to get tested if she has symptoms?
Yeah, so it really is a great question. Yes, if you have symptoms of COVID, regardless of whether you are vaccinated, you should get tested to identify whether or not you may have COVID. Otherwise, though, if you're vaccinated, you don't necessarily you don't need to do the routine testing that you might have done before working in a congregate setting. You're not going to end up being quarantined, so you won't have to test out of quarantine if you've been vaccinated. But if you have symptoms, yes, you should get vaccinated. I'm sorry, I just said that wrong. If you have symptoms, you should get tested.
And you should get vaccinated.
And you should get vaccinated.
Thank you, Dr. Rattay. We've had some people who are just joining us, so you've definitely answered this one already, but I want to go over it again. This is from Barbara Kay in email. Barbara asks, is it still the case that unvaccinated people should wear masks when around others? And Governor and Dr. Rattay, maybe you can address that one. So unvaccinated, should they wear masks?
Yeah, I'll jump in and then, absolutely. If you are unvaccinated, you're putting yourself and others at risk for the spread of COVID. Now, of course, there are plenty of people who are not vaccinated because they're not yet eligible. But regardless of the reason that you're not vaccinated, if you're 2 and up and you're not vaccinated, you should be wearing a mask around others in the indoor setting or the outdoor setting if it's a crowded space that you're in.
Thank you, Dr. Rattay. Here's another question: Is there a booster dose plan, and do we know anything about whether booster doses will be needed? And if that's the case, Governor, will we have another DE Wins incentive program to get people their booster doses?
Well, on the DE Wins part, we will have winners, I understand, that will be made public over the next few days. If nothing else, the DE Wins incentive program kept us going there, I think, and it was a lot of fun. It was a way of enjoying and putting some extra fun into the early summer season.
Yeah, I can tackle the hot topic, or one of the hot topics of the day, which is booster shots. Are we going to need booster shots? I think it's helpful to know that the vaccine manufacturers are, gearing up to develop booster shots. But what we don't know yet is if and when we will need them. A great thing is these vaccines are effective, and the immunity from these vaccines seems to be lasting a little longer than was expected, which is really fantastic news. I don't think any of us will be surprised if we do need a booster shot, but we just don't know if and when that will happen at this point. So CDC and FDA are looking very closely at the science. This is, they're going to continue to look at how the body's immunity to the vaccine, how long it lasts. Also, a factor here is the variants. And, if we begin to see certainly a variant that isn't well covered by the vaccine, which is not the case right now, but certainly that would be a reason for booster shot. What I will add, and I know that the governor and AJ will strongly agree, we are poised and ready to do another big vaccination campaign if we need to do booster shots for Delawareans.
We certainly learned a lot. We know how to do it, right, AJ? With great partners and great venues, we can certainly do it again.
Thank you all. We have a question about side effects from the vaccine. Marilyn Lewis asked, can you please address any side effects that may have been reported to VAERS, VAERS? Can you talk about, Dr. Tay, what that is and what kind of side effects we've seen from the vaccine in Delaware?
Yeah, sure. And it's a really great question. And I think never in our history in health and public health have we watched so closely to identify side effects of a vaccine. And not only is there the VAERS system where, anyone in the public, as well as physicians, healthcare providers, know to report side effects, report them into the system. We also have vSafe, which is a system where, again, anybody who's been vaccinated can report their side effects. So we are really able to closely monitor what types of side effects these vaccines might have. Most commonly is soreness at the site of the vaccine. And it's somewhere around 75% of people who get the vaccine have soreness at the site of the vaccine. But other more common side effects include fatigue, which happens to a lot of people. A lot of people are really tired. Some people are achy. Some people get headaches, some people get fever. So those are not uncommon side effects. Tends to happen more after the second dose of Pfizer or Moderna. And some people just don't feel great for like the 24 hours after they get the vaccine. Now, you probably heard in the news, there's some side effects that are more serious that have been watched more closely. For the Pfizer and Moderna, which are the mRNA vaccines. Myocarditis and pericarditis has been seen in some individuals, more in boys, more young in the young adult age group. This has been found to, for the most part, be mild and self-limiting and easily treated. But it is something that is being watched very closely. I will tell you, myocarditis and pericarditis are much more common from COVID-19 than from the vaccine itself. And I think that that's really important. And so a number of associations have come out, including the Heart Association and many others, and have said much more important that you get the vaccine and not worry about myocarditis or pericarditis and have them keep you from getting the vaccine. Johnson & Johnson is a vaccine in which we've seen a couple more serious issues. One is a clotting problem, which has been in less than 36 individuals so far, but as many will recall, in the April time period, there was a short pause for Johnson & Johnson, while really healthcare providers were really taught what to look for and how to treat it. So again, it's very rare, but it is continuing to be observed. And then more recently, something called Guillain-Barré syndrome, GBS, has been identified as possibly happening after the Johnson & Johnson vaccine. Again, very rare. We see it with other vaccines as well. For the most part, it is treatable, but now Johnson & Johnson and CDC, FDA are making sure that individuals are aware, healthcare providers are aware to keep an eye out for the symptoms of Guillain-Barré syndrome for individuals who have gotten the Johnson & Johnson vaccine. I know that was a long-winded answer, but I wanted to be complete because I know that this is an area that people are concerned, and we feel it's important to get the facts out there. But I will just say, very strongly, CDC, FDA, and we all agree that the risks of these vaccines are very, very low. These side effects, the more serious side effects, are very, very uncommon. And it is the benefit of getting vaccinated is much higher than the risks.
Thank you, Dr. Rattay. So I have a question here for Governor Carney from Daniel Lenz in the comments. How does Delaware compare, Daniel wants to know, to other states in terms of percentage of adults vaccinated against COVID?
Yeah, actually, I look at those numbers quite a bit, and to Daniel and others who are interested in those comparisons, you can go to the just Google COVID-19 vaccinations by state, and there's several databases that come up. The CDC one is a good one that I use, and we compare quite well. Actually, we're in the top tier for sure. If you look at the states, the states that are at the top are mostly northeastern states. And surprisingly, New Jersey and New York are among them. And I say surprisingly because they have among the highest, you can also check fatalities. They have the highest death rates from COVID-19 as well, but could be the reason that people are more motivated to get vaccinated. But it'll give you a whole list there, and we're in the top tier with respect to the vaccination rates. A lot of mostly southern states didn't meet their 70% goal, and you'll also see a correlation there with the death rates that they have, and there are standouts that are different. North Carolina, for instance, has a very positive, didn't meet the 70% goal, has a low vaccination rate, but also a lower death rate than Delaware. So interesting dynamics. You can see and make comparisons there for yourself about what's at work. States that tend to have poorer populations that are more vulnerable. Again, this senior citizen distribution is also often one that drives the fatality side of things. But if you look at those websites, you'll see we compare pretty well. I'd like to be better. I'd like to frankly be a vaccination rate like Maryland. Maryland does better than we do in our region. Other than that, we compare pretty well.
Thank you, Governor. And similar to one of the points you made there, we have a question from Clara in the comments, Dr. Rattay, who has, Clara says she's seen reports that new cases and all recent deaths due to COVID-19 in Missouri, I don't know if you're familiar with the study, but are among people who have not been vaccinated. Have we seen any of that kind of data in Delaware about severe cases or deaths due to COVID by vaccinated or unvaccinated?
And again, Missouri would be one of those states that didn't make the 70% goal and has a lower vaccination rate.
Yeah, and we are looking at our deaths to see, what the vaccination status is. We're now reporting on that on a weekly basis and on our Friday press releases. Fortunately, we didn't have any deaths this last week, but over the past few weeks, all of our deaths have been among individuals who are not vaccinated. Our epidemiology team is going to go back several months and get the complete data so we can provide a more complete set of information on that. But we also do keep a close eye on what we call our breakthrough cases. And we've seen about 223 breakthrough cases so far in the state. And for the most part, meaning individuals who've been vaccinated, it's just very few individuals who've been vaccinated actually get COVID-19, and a handful who have passed away, and we don't even know if they've passed away from COVID-19. So I would say by far and away, the deaths that we do see, and luckily it's not very many, but are among unvaccinated individuals.
And we sort of got this one before, Dr. Rattay, but this will be the last question we take tonight, and then I'll go to the governor for closing remarks. But we've had a few questions on this, so I wanted to ask for those who just recently joined us. Jeremy in the comments asks, what does the data say regarding immunity for those who were previously infected with COVID? Is there published proof that a vaccine provides significant incremental protection for those above previous infection of COVID?
Yeah, so it is a great question. There was a study recently published that was a great study that showed that those who previously had COVID-19 and then got vaccinated had a really good immune response. And so for those who have had COVID-19 and are questioning whether they should get vaccinated, yes, you should. But the good news is by getting vaccinated, you should have some pretty strong protection against getting COVID-19 again in the future.
Thank you, Dr. Rattay. And now we will go to the governor for closing remarks.
Yeah, I just want to thank our team again, Dr. Rattay and her team at Public Health, AJ, and his team, which goes beyond state government into county governments, and our paramedics and our Army and Air National Guard, the hospitals, the pharmacies have come up big. I got to really give a shout out to the pharmacies over the last several weeks as we really tried to reach our goal of 70%. They were instrumental in that. A lot of people that helped us do that. Our live stream team, you never see them, but they help us put on the press conferences on a weekly basis. They're helping us bring the production tonight, the town hall meeting to answer all your questions. To end, I'd like to see if our live stream team can put up the initial data update, just to again underscore the fact that there still is presence of COVID-19 in our community. You see 29 cases a day on a 7-day moving average. That's about 10 per day, better than the low of below 20 positive tests. Again, we're at 1.8%. Again, we were under 1% 2 weeks ago. Hospitalizations reached a low of 14, and we're bouncing around 30 now. And sadly, 1,695 lives lost, but we didn't have any deaths this past week, and they can continue to decline. And so the situation is improving, and it's staying at a good level at the moment. The way to get to and stay at a better place is for more people to get vaccinated. We met our July 4th goal that the President Biden set out for us at 70% of adult Delawareans. We're adding to that every day. It's not too late. We have really probably one of the biggest challenges that we've faced in the last 2 years, which is to get all our children back in school for in-person instruction in September, and during these summer months to make sure that children are able to catch up where they might have lost some learning. So we have a lot of work to do. We've got great partners in doing that work. We need your help to get vaccinated if you're not. If you're not vaccinated, make sure you're careful in indoor settings in particular. Wear a mask, particularly if you're around a group of 19 to 35-year-olds, which is a group that's less than 50% been vaccinated. Some of our Black communities also have low vaccination rates. Again, it's in that young adult demographic. So just be careful when you're in environments, indoor environments, where you should be wearing a mask and you have others that might be COVID-19 positive. It's still out there at a much, much lower level than it was at the peak. Our peak in hospitalizations was over 450. I think, AJ, we're down to 27. So we're in a much better place, and we're in a much better place because so many of you followed the guidance that we were providing through our public health team that we were getting from Centers for Disease Control and the science being developed across the country and around the world. Thanks for joining us tonight, and we'll see you next time.